Welcome back to Daybreak. Nearly half the states in the U.S. are beginning to ease restrictions that help stop the spread of the coronavirus. Right now, 8 different vaccines are in human trials around the world, but they are not ready yet. Without a vaccine, health experts warn and fear that it's not a matter of if we will see a second wave of coronavirus, but when. And here in Texas, we mentioned yesterday marked the 5th day in a row for Texas officials to confirm more than 1,000 new cases. More than 34,000 cases have been reported in the state. According to the state health department, 948 Texans have died from the virus. Hospitals and healthcare workers must be prepared for patients that come through their doors. And joining us now is Dr. Devry Anderson. He's the Chief Medical Officer at St. David's South. Thank you so much for joining us today.
Good morning.
Good morning to you. And you know, Doctor, as more businesses open up, we loosen up restrictions. What steps are being taken to prepare for a possible spike in patients?
Excellent. So we at St. David's Healthcare have been doing everything we can to ensure preparedness for an increase in patients in our region should one occur. So all of our hospitals have a surge plan. And so we're working closely by monitoring the pandemic models to determine whether or not we need to enact a number of scenarios. Those include, please go ahead.
Continue. Those include?
Well, those include things like ensuring we have the appropriate number of caregivers, the appropriate number of PPE, and programmatic kind of systems in place to ensure infection prevention within our hospitals.
And that's kind of going towards my second question here. You know, we're talking about making sure that the hospitals stay sanitized, keeping them clean. It must be a huge undertaking. So let's talk a little bit about that.
Absolutely. Well, here at St. David's Healthcare, we're committed to doing everything possible to ensuring we have the best care environment for our patients and for our caregivers. And so we're doing things like ensuring we have limited access points and that we have limited access through those access points for patients, for providers, for visitors, and for staff. We're ensuring that we have temperature checks at all of those access points. We're ensuring we keep the hospital clean by making sure we clean or remove high-touch items such as buttons on our elevators, doorknobs, etc. And so, of course, ensuring we have universal masking within the hospital and for all patients and visitors, which is above and beyond the CDC recommendations.
And Dr. Anderson, it's my understanding that people are delaying emergency life-saving care due to fears surrounding COVID-19. So what advice do you have for people who need to go to the hospital for a medical procedure, they need to get checked out, but they're hesitant?
I would encourage people that aside from being home, the hospital is the safest place that you can be because of the measures that we have in place. It is dangerous to delay potentially life-saving care due to the anxieties that we know we all have surrounding the COVID-19 virus. But here at St. David's Healthcare, we're doing everything we can to ensure the safety of our patients when they arrive, including making sure that COVID-19 patients are seen in a separate care area and masked and escorted to that area when they arrive. And of course, ensuring that non-COVID-19 patients, even experiencing outpatient care or coming for a surgical procedure, are seen by different caregivers than those caring for COVID-19 patients and are cohorted or separated in the hospital from those patient areas.
Oh, I see. Okay. And is St. David's Healthcare exploring treatment, perhaps treatment options for COVID-19?
Absolutely. St. David's Healthcare is involved in a number of national trials, including the use of medications like tocilizumab or convalescent plasma. And so we're ensuring that the latest treatments are available for all of our patients, remdesivir and every available medication that's out there in the United States. HCA and St. David's Healthcare are participating in and ensuring we make available for the appropriate patient populations.
And before we go, Dr. Anderson, we've reported some instances of people ignoring social distancing. They're not wearing their masks properly or not wearing them at all. You and your staff, you're on the front lines. You see the patients come in. You're dealing with this more than we are. You know, what's your message to those who are just ignoring the rules?
I would encourage everyone to stay vigilant. If you can stay home, do. But if you're going to go out, wear a mask, practice social distancing, practice good hand hygiene, make sure that if you cough or you sneeze that you cover that and that we do everything possible to prevent a secondary spike of COVID-19 in our communities.
Dr. Anderson, thank you so much for your time. Thanks for joining us.
Thank you so much. Have a wonderful morning and stay safe out there.
You too.